welcome to another episode of Kettering Chats. My name is John Stamper from Medcast Productions, and it's always a pleasure to be with you here this evening. Tonight's health chat is stroke awareness and prevention. So when we think about stroke and we think about stroke awareness and prevention, what are some of the warning signs that somebody needs to know that they could potentially be having a stroke?
Sure, and that's a very important question because stroke is truly an emergency. And folks need to realize that if they're noticing something that could be a stroke, to call 911 right away. And the most common things that we'll see with stroke would be weakness of the face, droopiness of the face where it's kind of pulling down a little bit, maybe the smile is crooked, weakness of an arm or a leg, and then speech is really important. And then probably something else people don't think about a lot, if you have a very sudden, horrible headache, the best way to treat a stroke is to prevent a stroke. There are multiple things that can lead to a stroke, and some of the medical conditions that we worry about, high blood pressure probably being the most important that we see, diabetes, smoking. Physical inactivity along with obesity is a risk factor. Cholesterol, hyperlipidemia you can see on the chart there. And then a high sodium diet, and that's a very difficult thing to address. So those are really some key aspects and risk factors for stroke among some other things. There are ways to prevent the next stroke other than modifying your risk factors. There are medications that can be used to thin the blood, medications that can help reduce the cholesterol and also stabilize blood vessels, make them healthier. So just by pure cost, you're really not saving by not going to the doctor. And hospitals have ways of helping people. They can get assistance. They have professionals at every hospital that really work on that with folks. So follow up with your doctor with those types of treatments, including, again, also changing your lifestyle to prevent anything that could happen again down the road. That's what I would emphasize.